It's really exciting to see this begin to take shape as we've prepared long and hard for this moment. I can also tell you that it's only come after months and months of the availability of the data, trials that included over 4,000 young children, 5 to 11, to make sure what is now a lower dose. So the adult dose of Pfizer is 0.3. The pediatric 5 to 11 dose is 0.1. So it's a third of the dose that adults are receiving, a third of the dose that even our adolescents 12 and older are receiving. So it's a lower dose, a different formulation, and it's available specifically for this 5 to 11 population. The studies that were done, the trials that were done to make sure that this vaccine is safe and effective at this dose were robust. They came together in rapid fashion in order to address this important pandemic, recognizing that vaccines are the way through the pandemic and allowing us to get 5 to 11-year-old Californians. They represent 9% of our entire population. Regina, you mentioned some of the different population sizes of our different groups, whether it's young Black children or Latino children or Asian Pacific Islander children. We know that we have quite a few 5 to 11-year-olds. Like I said, 9% of our entire state now has a chance to get the same protection that so many older Californians have had for many, many months, that have protected them and kept our communities safe. We have a large national study that looked at 5 to 11-year-olds, and they're very good at making sure that it's a representative population. And so making sure that we have young people from all regions of the state or the nation, all races and ethnicities, young people with pre-existing conditions, as well as young people without, to make sure that it's a representative sample. That all said, I always encourage, as a pediatrician myself, that parents and families go ahead and connect with their trusted clinical provider, whether that's their family doctor or pediatrician, whether that's another source of important health information, to get the questions answered so that you can go in to getting your young person vaccinated with a great deal of confidence and reassurance that this is the right thing to do. I can share with you all of the data in the world. We can give you all of the information that I think is convincing and important, but that trusted individual that you turn to, I think, is going to be a really important person to help you ultimately feel confident and make the decision. I'll remind you that we've had hundreds of thousands of cases among young people. 60,000 young people, 5 to 11, have been hospitalized in our nation, and we've lost more kids to COVID than we do to other vaccine-preventable diseases in our nation. In California, we've lost over 30 young people to COVID, and any additional death of a young person is unacceptable if it's preventable. So we must use this tool to not just protect our communities. We often talk about how getting young people vaccinated is going to help protect our families, our older Californians, but I often focus now on how important this protection is for our young people themselves.